Good night, Dorian. Please, let's wait until 8:05 to your classmates, okay?
Okay.
Okay, see you in some minutes.
Yep.
Okay, good night. Good night. Diana, Laura, and Jimena. Dorian was the first one. Let's start, okay? Okay, can you watch my screen?
Yes, teacher.
Okay, great. Today we are going to continue with investigation. So you are going to check as a fact the difference between invasive and non-invasive procedures. The difference with some examples. It could be interesting, I think. General view about lab tests, endoscopy, X-rays, CT scan, MRI, ultrasound, and electrocardiogram. We are going to be in class until 9 and 5 because we are starting around that hour. The contents I don't have enough time for finishing tonight. We are going to study them tomorrow during the workshop. Okay, so let's make our best. Invasive and non-invasive, of course. The difference following the name is so clear, I think. Invasive ones, invasive procedures are all of them that are invading the body or entering by a needle, tube, device, or scope. Of course, the purpose is to access into the body, gaining a via, an incision, a percutaneous puncture, an instrument, something that is getting into. And of course, it can cause pain. Okay, if we don't use anesthesia, we don't develop the procedure in the way it has to be, it causes pain. Okay, we can use a puncture or an injury, or we can use a natural orifice. For example, the mouth, the anus, well, we know about it. Non-invasive procedures, of course, all of them that doesn't require inserting any instrument through the skin or into the body, okay? We don't have to get into more. The best example, the ultrasound. The difference, of course, it's obvious. Invasive tests by cutting or entering into the body. Clear. Non-invasive don't require breaking the skin. Of course, patients get scared when we say that we are going to develop an invasive procedure. And they can imagine this, just a needle, like a knife, right? But it happens. And that's the way we can work. Non-invasive tests include deep palpation, X-rays, and checking blood pressure, of course, because they are not making an injury or puncture or something like that. Lab tests, of course, we all know about it. Lab tests are all of the procedures that involves testing a sample of blood, urine, or other substance from the body. Lab tests can help to determine a diagnosis, plan treatment, check if the treatment is going okay, is working, or to follow, to check, to monitor the disease over time through the time, okay? One of the most common studies we develop is taking blood. We all know about it. I think we as doctors, maybe during the career or becoming a professional doctor at this point, we had the chance to take a sample of blood. We got the chance to develop the venipuncture. And of course, taking this blood, we can decide, or we can make the correct diagnosis, or maybe the sample of blood has to be taken from a doctor. It could happen, for example, when we study the bloody gases, right? In this paragraph, we have again blackened words that are the specific vocabulary we have to study. That's why let's read this. During venipuncture, the phlebotomist, I mean a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube. which is sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow. The antecubital fossa that is easily accessible. She may apply a tourniquet, a tight band above the site, or the patient may be asked to clench their hands to make a fist in order to make the vein more prominent, okay? Afterwards, the patient may be asked to press in lightly on a dressing, usually a piece of gauze, to help the blood to clot and to prevent swelling and hematoma. We know a black and blue mark or a bruise where the vein was punctured, okay? A bruise is a specific mark. Bruising can be used to describe number of bruises on a larger area. The patient exhibited bruising on the right forearm, for example, like this guy, right? We all know how lab test requests are done. All of them have the same abbreviations. In Spanish, in English, is the same. Both of them use abbreviations following the language. We have to remind that it's a very, very common situation. And in order there are forms, we only have to check the list, to check the study we certainly need, but we have to ensure about the meaning. In this example, in black and words, I'm showing you the most common ones: MSU, CSU, NP secretions, BAL, SNO SW, SW in virus TM, okay, blood culture, EDTA blood, CSF, well, we know. Some more, we have the terms we have to study properly in the request, for example, feces, sputum, things like that. Let's check. Here's another example, a clear one. And as you can see, we have lots of abbreviations, okay? MRSA, PCR, well, you know, same in English and Spanish, just checking the meaning and catching the properly meaning, okay? What about the meanings? The common ones that we are checking in the previous slides are MSU, for example, midstream urine. CSU, catheter specimen of urine. You can see that's different. Both of them are coming from urine, but different technique to take the secretion, the urine, okay? MP secretions, nasal passage secretions. BAL, blood alcohol level, you know, nose SW, nose swab, always swab in this way, SW. SW in virus TM, swab in virus transport medium, okay? EDTA blood, ethylediamine tetracetic acid, in vitro anticoagulant, okay? CSF, we all know, cerebrospinal fluid, MRSA, methicillin-resistant Staphylococcus aureus, VRR, ESBL, CR, PCR, well, we all know about it. Check this information because this slide is so important. That's why we got our blue guy here. When you get a report, we know we receive like this. We get the full term and abbreviation in parentheses, following the lab you are working on, right? We got the value of the patient, the normal range, and the unit when it's developed. Why the units? Because of course, according to the laboratory, they can use one kind of units or another one. It's their choice according to the protocols they follow. And they send us the range to compare values and decide how it's going on. Same way all over the world. Same way, no way to change it. Abbreviations are shown here in order to catch their meanings, the properly ones. And we know that when we go to the request, like this, we only have to look for the abbreviation. And when we get the report, we got the meaning of that abbreviation. That's why we have to memorize this information, okay? It's just an extra slide showing you the normal values. Normal values for checking how it's wrong, how it works in USA, okay? It's for you. That's the way of working. And now we got this, the unit abbreviation and the full form. We got this. In Spanish, of course, we know. Grams per liter, grams per liter, liters per liter, 10 times 10 to the power 9 per liter, okay? Femtoliters, millimoles per liter, micromoles per liter, units per liter. It's just an example. Of course, we have some more charts, but for starting, I think it's a good way to catch the information, okay? Then we got these specific terms. When we catch the situations, when we have to describe the lab results as a doctors, we got expressions, right? For example, this, when results are within the normal range, doctor says, for example, potassium is within normal limits, potassium is normal, potassium is unremarkable. 3 ways to give the same information. If the level of the element is high, we can say potassium is up, is elevated, is high, is raised. And the opposite situation, potassium is down, potassium is low, or is reduced. These expressions are the common way to give us the value when we are during a speech, when we are reporting a case. Of course, we have to know the values we are treating with our patient, but far away from that, we have to know how to give these explanations, okay? How to give this information in a properly way. That's why this slide again is important. Then we got this, another one. This invasive procedure, the endoscopy. Endoscopy is a procedure that uses an endoscope, a machine to examine the inside of the body. We get into through the mouth usually, and we can check the throat, the esophagus, the stomach, and a portion of the small intestine. While we are into, we have the chance to take some biopsy specimens in order to study properly the situation with our patient. Through these times, through the period it's being studied, endoscopy is changing, is getting comfortable, is getting better because it's flexible, it uses anesthesia, the procedure is safer than at the beginning. It has lots of advantages. That's why we should consider it as a great procedure in order to make the proper evaluation. Okay. Similar to the previous class, we can check a typical endoscope is flexible, the flexible tube, which is inserted through one of the natural orifices. The openings, such as anus or mouth. Rigid endoscopes, of course, at this point, they are still in use. They cannot bend and are also inserted through small incisions, surgical cuts. The shaft contains several channels. This is the shaft. This is the shaft. This piece contains several channels to transmit light from the outside and images from inside and allow different instruments to be used. It has lots of entries, right? The parts of a basic endoscope are the eyepiece, tube for putting the instruments. From this place we introduce different instruments, for example, the material for taking biopsy, Then we got the flexible tube, of course, and then the flexible shaft for light and water. Okay, at least it has 3 channels for placing properly the light, for sending water, for cleaning the lens, and then this tube in order to introduce pieces that are necessary. We got endoscopy, how it is inserted. And we are checking the first portion of duodenum in this case. And all of this information we are watching in a video. Then we got an example of how the biopsy is taken. You can see this is the endoscope tube. There is the light. You choose the place and take the biopsy sample. Usually 3 pieces are taken. Of course, functions in a very, very general way. We got provide diagnostic information to excise or cut out diseased tissue or growths such as polyps, clear obstructions to take biopsy, okay, and to cauterize a site of bleeding by applying heat or electricity, okay. As you can see, nowadays it's a safe procedure, takes very little time if the doctor that is developing the procedure has experience, of course. You would walk back home in most cases. You are discharged home while finishing. Of course, it's aseptic, doesn't interfere with breathing. It helps in your diagnosis, of course. An enteroscopy it's the same procedure, the same way to get into, but we got lens in a bigger space into the small intestine. We inflate the balloon and then the lens continues. The balloon is like the first limit. We have anatomical positions to stop, inflate the balloon, and then the lens continues getting into. Just extra information. Same with enteroscopy, of course. We start with fluids. We prepare the material. We induce an anesthetic to our patient. And then we develop the procedure. While finishing, the patient stays some hours, a couple of hours in care with us, and according to that, can be discharged. Usual enteroscopy instructions, when we consider expressions, could be like this. Now I'm just lubricating the tube with a jelly, which contains local anesthetic. It helps to ensure a smooth passage as it passes down, and you shouldn't feel too much. Another way, I'm going to feed the tube throughout your nose. This is the most uncomfortable part of the procedure, but it's very brief. You'll get used to the tube in a few minutes, okay? When it hits the back of your throat, take a deliberate swallow. I'll tell you when. And while introducing, you tell the patient, swallow, swallow, and that's all, okay? If you had the chance to introduce a tube from nose or mouth, you know that patient has to swallow for not mixing the natural orifice, the digestive tract, and not going into the respiratory tract, okay? We know about it. It's just for making a review. About the report of the diagnostic endoscopy, we have to follow all of these ideas to ensure we are describing the whole procedure with the ballot. At the beginning, we get the informed consent. It was obtained from the patient after discussing risks and benefits to the procedure. The patient was connected to the pulse oximeter and placed in the lateral position, left lateral position. Of course, left lateral position is safe because if the patient vomited, it's easier to get it away and not get into the airways. Oxygen was provided through a nasal cannula and the premedication administered as stated. The endoscope was introduced into the esophagus At the end of the examination, the patient was transferred to recovery area to recuperate. All of these steps, all of these speeches necessarily. And again, we have here blackened words, blackened expressions for catching the correct meanings, okay? The catching the expressions we certainly need. This is just an example about an endoscopy when everything is normal, so don't worry about it, just an example. Talking about X-rays, well, we all know, we all had the chance to watch X-rays, the common one, chest X-rays. For example, this one that is in the picture. As a definition, X-rays are a type of radiation used in the diagnosis and treatment of cancer and other diseases. As a general, very general idea, we can tell that. In low doses, X-rays are used to diagnose diseases by making pictures of the inside of the body like this. In high doses, X-rays are used to treat cancer or different situations. The white part is radiopaque, the black part radiolucent. There is a difference in idea, in concept about radiography and radiology. Radiology is the use of radiation in the diagnosis and treatment in diseases such as cancer. That's radiology. And radiography involves exposing a part of the body to a small dose of radiation and then get an imaging to internal organs. For example, bones, the common indication, okay? Organs with high density such as ribs and spine are radiopaque, meaning they do not absorb radiation and appear white or light gray on the image. Lung tissue, for example, a soft tissue, is radiolucent, absorbs radiation, and appears dark on the image. We all know about it, just a review. This slide, in my opinion, is important because here we are checking some anatomical structures, some anatomical details that are important. Here we got the anatomical references, for example, trachea. These small ones are spinous processes, the aortic knob, the left ilium and pulmonary artery, for example, right atrium, left atrium, the costocardiac angle, the costophrenic angle, right hemidiaphragm, left hemidiaphragm, right ilium and pulmonary artery, the carina. We all know this structure is so important to define when the trachea is divided into the big two branches. And now we have some details for assessing properly the X-ray, which areas we must describe. We don't have to forget them. For example, the outline of the bones. We got assess the heart borders, check and compare the ilium position, density, and morphology, of course, because we know through the experience, through the way we are studying, that every change must be reported, okay? More details for catching these differences. X-ray, abdominal X-rays anatomy, that's a normal one. Please check these slides, they are for you. Review areas when we cannot lose the description of abnormal anatomical details or situations that we are finding, okay? Before some types of X-rays, patients are given a liquid called a constant medium. We all know contrast. The contrast medium is the one that helps the soft tissue to absorb, to define its shape, and according to that, it's possible to infer the proper diagnosis. An example, barium or iodine, which is radiopaque and allows the organ or tissue it fails to be examined. The contrast medium may be swallowed, introduced through the anus as an enema, or given as an injection according to the situation, okay? When we talk about the X-ray examination, we know X-rays certainly need a specific position from the patient for taking the best picture, the best X-rays. Normally, a frontal view is obtained, I mean an anteroposterior. For example, the patient stands facing the photographic plate. This big one is a photographic plate with the chest pressed to the plate, with hands on hips and elbows pushed out. You can see, and push out in front. The radiographer, the technician who's taking the X-rays, asks the patient not to move and to breathe in deeply and not to breathe out. I mean to stand the air into the lungs. This makes a blurred, unclear X-ray image less likely and improves the quality of the image, as it's easier to see abnormalities in area field inflated lungs than in deflated lungs. It's easier while taking a deep breath. Common expression, take a deep breath. When you take it, you can say, hold your breath. So just for catching extra information, okay? When the patient takes the air, we should say, keep still. I mean, don't leave the air, keep still, don't move, keep still, okay? When we consider a lateral view, the patient is asked to stand sideways to the photographic plate. Again, this big one is a photographic plate with arms raised, okay? A chest X-ray may be repeated at intervals to track for any changes. These repeated examinations are called serial chest X-rays, for example, serial abdominal X-rays. Usually when we as doctors want to check the digestive tract, the GI tract, and we use a contrast that can be taken by per mouth, by oral, in a liquid, we ask the patient to stay with us around 4 to 6 hours, and we take a serial of abdominal X-rays. With that technique, we ensure that we are collecting pictures in a period of time and we can evaluate properly the situation. Just an extra slide when we are comparing the posterior-anterior view and the anteroposterior view, just as an example to catch differences. Now we have X-rays from children, normal one, a boy with a bacterial pneumonia, another one with viral pneumonia, you can see a difference, and now COVID-19 pneumonia. Just an example for making the comparison and watching that the anatomical big details that I was showing you in previous slides must be present in the serial X-rays. This chart and the next ones are extra information. Here you got the pathology. For example, there are metastases. You have the definition, how it looks in a picture, and looking for this, you find the same situations into the X-rays in different pictures, and we make a contrast with the CT scan. Why the CT scan? Because CT scan uses the same principle. We are going to check it in a minute. Here you got metastasis, interstitial nodular, acute interstitial ground glass opacity, chronic interstitial reticular, right? Then you got pulmonary embolism. Again, how it looks, which small details we must check with this evaluation because it's cheap, it's safer, and non-invasive, no causes pain. We got acute pulmonary edema. You can check. And we are checking a congestive cardiac failure. How heart looks here. It doesn't look as big as the picture, but if we go to the real measurement, it is similar to the picture, to the drawing, I mean. Here we got one pattern of pneumonia. We got with some atelectations. We got emphysema. So as you can see, it's a lot of information, right? Now we are checking here pneumothorax and effusion, how an effusion looks, and a carcinoma. Read, please, all of this information. Read the small charts. This vocabulary is for talking properly at the moment to report a case or to evaluate a patient or to talk with other colleagues for catching the correct diagnosis. Now we got this. This again a joke. Don't be alarmed, it's just our technician photobombing your x-rays. The action to get into a picture when you are not planned like this is a photobombing. It's a great expression. I know, I like it, and it's kind of fun. Let's talk about ultrasound. Of course, ultrasound is a very, very common study. Cheap, so cheap. If we make the comparison with other studies that we usually require. And of course, it's a procedure that uses high energy sound waves to look at tissues and organs inside the body. It doesn't cause any pain. So if patient says, I'm hurting, it's painful or something like that, it's a lie. We know about it. Going to the way it works, the sound waves make echoes and form the pictures of the tissues and organs on a computer screen, like this. It's the sonogram. The ultrasound might be used to help diagnose diseases. Again, such as cancer. Why cancer? Because usually we got tumors with that situation. Checking how the ultrasound works, it uses high frequency sound waves, as I was telling you. And waves are generated and received by a handheld device. It's called transducer. The device that the doctor uses and moves by hand is a transducer. Okay, the transducer gets into some crystals that send the sound wave and receive the signal, and this information goes through the screen. The reflected waves are processed by a computer and produce detailed images for display on a monitor. Ultrasound is safe as it doesn't employ ionizing radiation like X-rays. You know, it's clear energy, clean energy, right? It's cheap, quick, and non-invasive, of course. There are the three advantages. No requires a surgical procedure. And it helps to determine which specialist we are going to send our patient if it's necessary. And well, that's a great way to work on. Now, when we prepare the patient to an ultrasound, we must evaluate again how it works. We explain the patient the importance of this study. Then we get the informed consent always for everything. It's better to get extra paper than losing a detail like that. We have to ask for permission of the patient for doing this studies, okay? When we get all the information clear, we ask the patient to lie down on an examination table. Then we apply gel to the skin. It's usually cold. And this gel ensures that there are no air pockets between the transducer and the body. If there is air, the sound cannot go properly and the imaging is not trustable. Then the transducer, of course, is placed on the gel and is moved over the area to be examined. You may feel some pressure and experience some discomfort if the doctor that is developing the procedure uses too much strong or pushes so hard, then it's a discomfort. It's not always, it's not a rule to be uncomfortable. This discomfort is very easy to catch when we have the full bladder. For example, men who require a prostate control and you develop the ultrasound, they have to go with full bladder. Usually, we ask patients for changing positions and get clearer pictures. And when the doctor, the radiologist that is developing this study is satisfied with its pictures, the test is done and the gel is whipped off. Usually it takes 20 minutes or to 1 hour to be done, but of course it can take more time. It's not a rule to stay there just 20 minutes. When we get a medical imaging like X-rays, CT scan or something like that, we got these expressions. Or when we get the pictures of the ultrasound or maybe the video, we say an ultrasound scan shows an intra-abdominal abscess. Or we can say an ultrasound scan of the abdomen demonstrated a small right renal tumor. Great. Or we also can say an ultrasound scan of the liver revealed reduction of metastases. As you can see, we got 3 verbs that are so useful. Show, demonstrate, reveal. And as you can notice, all of them are in past. Why in past? Maybe the ultrasound is developed now. And 2 hours later, the specialist gets into the room in the ward round and checks the inform, checks the report. He has to talk to read all of the studies according to the hour they receive. That's why you have to talk in past for checking the correct or the properly grammar structures, okay? Verbs, important verbs, showed, demonstrate, and revealed. Let's talk about the CT scan. It's, in my opinion, one of the best studies we get through the time. The computerized tomography, or CT scan by abbreviation, is a procedure that uses a computer linked to an X-ray machine to make a series of detailed pictures of areas inside of the body. This is the CT scan. This donut, this big round, and from this round, X-rays are coming into your body. The entire body, not just the section they are evaluating. Of course, it's not. It doesn't happen. It doesn't happen in that way. About the uses, or which resources we prepare to evaluate patients. Well, in my opinion, it's a personal decision. But we are ruled by protocols, so let's follow the protocols. The CT scan, the donut, rolls over itself and takes pictures from the smallest slice, we can say, for example, of the body part. I mean, we are not taking just one X-ray. We take around in 10 centimeters, around 20 or 30 X-rays in order to check small details like a piece like this one. You can check this. It's not just for 20 minutes, it's just this chart, this report, I mean, this picture are not all over the images the CT scan is taken. We have protocols that show us which specific slides have to be there for catching the different anatomy structures, okay? Or we also can check in video. It's the way we can work on. As you can see, the scanner takes up to 16 simultaneous cross-sectional images, slices, and transmits more data in less time than ever before. Nowadays, it's possible to send all of these bodies. To wait for the specialist and send it by WhatsApp, for example. And transmissions more data in less time than ever before, of course. Each slide can be less than 1 millimeter thick. You know, very, very, very detailed, according to the generation of the CT scan. Uses of CT scan, diagnosis of muscle and bone disorders. It's used for locating tumors, used for checking infections, for example, abscesses and clots, monitoring to progress of malignant diseases. Then we get providing accurate guidelines for interventional procedures, such as biopsies and drainage. Of course, we can take a tumor and catch the inside with different maneuvers or different devices. And it also can help to take away the blood or the pus according to the situation you are considering. The views of a CT scan, we got 3 basics. The 3 positions that you are always going to see in CT scans are axial, coronal, and sagittal. And that's the way they look, okay? The way they look, for example, sagittal by its side, right? We all know about it. The key points for reading a CT scan are in this slide. Soft tissues, fluid, and blood will show up in various shades of gray according to the density, according to everything. They change in color. Air and fat shown up as dark gray or black. So we can get confused sometimes while checking because, well, everybody thinks that checking the organs, the inner organs, it's possible to make the diagnosis, but no, it's not the way it works. Another example about a picture. Another one. Now, in this chart, the next ones, you get some patterns about CT scan. When I'm showing you details and how to describe the lesions. For example, the ground glass, very common during the pandemic times because that was the pathological picture we are looking for giving COVID-19 diagnosis, right? Then we have crossy paving. You can see the pattern and how it works. Okay. Now we are checking a vascular dilatation and we are checking attraction of bronchiectasias in this next slide. So it's not, there are just examples for catching how they look, okay? we got supraneural bands and architectural distortion. I mean, you can evaluate, like in this cut, everything from skin and inner as you want. Again, we got jejunal perforation secondary to a blunt abdominal trauma. Okay, that's the same, but in contrast. Checking how this part works in my during the experience. Let's talk about the MRI, magnetic resonance imaging. In my opinion, it's greater, resolution is higher, and it's so far is much better. And this procedure doesn't use radio waves, okay? They don't require radio waves. They are untoxic, okay? They are getting, nowadays they are getting more accessible. It's easy to catch the MRI, but of course the cost is so high. This device uses a powerful magnet and then a computer to catch the imaging and show what is going wrong. Of course, MRI, in order don't use X-rays, are safer than X-rays, of course. They don't use radiation, of course, and provide more information and about X-men. And well, we have to consider this, the differences between light areas and if they are stronger, okay? So I think it's clear if you compare this resolution with the CT scan, of course, MRI has a higher resolution. Contraindications, of course, not everything must be perfect. Yeah, but they are going to this. Contraindications, patients with metallic foreign bodies, for example, a plate in the cranium that certainly can be attached with the MRI with the magnets. And then we got patients with pacemakers. I mean, that device that is placed on tooth and teeth, because they need that. Just one girl is having fun. Okay. So these pacemakers, are like this. These devices, metallic devices that certainly the magnet can attract, can call, and the patient could be injured, or maybe the procedure is not possible to develop. The MRI is not approved during the first trimester of pregnancy. There's no clear reason, but it's better to be prepared. When we prepare the patient for an MRI, we ask for a safety questionnaire, and they must be so clear and sincere with this information. The technician emphasize that no metal on clothing or into the body are allowed if there is the situation and the patient cannot take away the metal piece. Well, the procedure is not developed because magnets can take away so hard this device, okay? You give all the information, of course, talk about antecedents, and well, the responsible of this service is the one who sets you on a scanner table, and you must be comfortable. This study is so noisy But well, that's the sacrifice we have to make because we certainly need a proper image, okay? Again, during the test, if we need to evaluate something in thorax, the technician would ask for taking a deep breath and then keeping still everything or staying still. Well, the sequences are extra information for catching the vocabulary, the properly one. But here you got T1 and T2. The difference is the cut, is the portion, is the structure we are evaluating. Just for making a comparison and catching details that might not be in the first picture, of course, you need a second one. Then we have again extra reading the abnormal MRI signal in order to recognize what is going wrong. Okay, and let's talk about the electrocardiogram. I think we can finish the class tonight. Perfect. The electrocardiogram, we all had the chance to see one of these records. Maybe we had the chance to take one or to be the patient and have our own electrocardiogram. It's a simple test that can be used to check your heart's rhythm and electrical activity. We all know about it. Sensors attached to the skin are used to detect the electrical signals that are produced by your heart each time it beats. This machine is tracing, is drawing, is produced by an electrocardiograph, a device which records electrical activity, right? An electrocardiogram records the electrical signals in the heart. We check this and it is painless. It doesn't hurt by any reason. You only must be relaxed, must be quiet, not moving during the tracing because the reading could be wrong. Well, uses of an ECG, of course, are important to summarize again. It helps us to decide if heart is performing normally or if suffering from abnormalities, for example, cardiac arrhythmia, or extra arrhythmia, or skipped heartbeats. I mean, the pump, the sound is going properly in a rhythm, and then it's out, it disappears. It's a skipped heartbeat. It shows us the heart muscle damage, for example, heart attacks or ischemia, or in the heart muscle, the angina. It helps us to find condition abnormalities, for example, heart blocks and bundle branch blocks. Then we got it as a screening test because we can choose a study population, and according to that, we can look for example ischemic heart disease during an exercise tolerance test. This screening helps us to organize the inner protocols and according to that, improve our capabilities. Well, moreover, this device provides information about the physical condition. Electrocardiogram is one of the best friends of the cardiologist, of course. And well, it helps us to detect electrolyte disturbances. For example, low levels of potassium into plasma. Don't worry about it. Okay, electrolyte disturbances are possible to check. Let's see. Here you got some examples. You got the ECG analysis with lots of details. different pathologies are being supported by this. And we have this, the ST depression. As you can see in all of these records, you can catch different situations. For example, ST elevation or the Q waves or supraventricular tachycardia, or maybe the ventricular tachycardia, right? Just examples. Following the procedure, of course, the patient is in a bed. The patient has to be relaxed. If the patient is under stress, the trace is failing. We calibrate the ECG machine, and then we place the limb leads, the heart leads, and then we start the procedure recording the scene, recording the trace. Of course, we have to apply it to the electrolyte, we have to apply on the patient's skin, again, transparent gel. And according to that, we break the pocket, the air pockets, and then we can start making the study properly. In this slide, we have the V1 until V6 positions. Follow this, try to memorize this because I'm gonna ask. A normal ECG has its structure. You can see there are complexes, segments, waves, and intervals. Consider this a specific way to explain how an ECG is working. Well, we got a trace as an example. And now we have the rules of a normal ECG. The rules that we should know everybody, and we got the chance to review tonight. It's for you, check it at home. And during the workshop, we can solve doubts about the specific vocabulary. So don't forget it. Eric Thomas said that greatness is a lot of small things done well. If we want to make a great job, we have to do our best, right? That's all. That's the presentation for tonight. So, same as always, let me send you the pool to take attendance. And while you are taking attendance, I'm gonna send the diary pool, and I'm gonna upload the file. Okay. Okay, can you watch the pool? Let me see, can you all watch the pool?
Yes, Miss.
Okay, send me the message to the chat. Tell me got it, or let me know that you got the slides, okay? That you got the pool, that you feel the pool, and now it's taking more time than I was expecting. How the file is getting uploaded. Please, a little bit of patience, I'm sorry. Okay. Oh, it's not the file. I'm sorry. Oh, okay. The file is there. Let me know by a message that you got it, and then you can leave. Can you all watch the file? Okay, did you get the file? There are two people that are not filling the pool. I'm sorry.
Teacher, could you send us again, please?
The pool, okay, Elena. Jimena, did you fill the pool? Did you have the chance to fill it? Okay, I send it again. Okay, thank you, Laura. Thank you, Laura, again. Yeah. Okay, Elena, I send it. Great. Elena and Jimena, did you fill the pool? Did you have the chance to do it?
Yes, miss. I sent a message.
I send it to.
Okay, great. Well, I think everybody filled this. If no, it's out of my hands. Yeah. Okay, can you all take the slides?
No, yet, miss.
Okay, great, Alejandra.
Teacher, I have a problem with my cell phone, you know? Could you send me, please, inbox?
Okay, I'm gonna try. Please wait for me, okay?
Thank you very much, teacher.
Okay, Dorian, perfect. See you tomorrow. Bye-bye. Jimena, did you download the file?
I can't, miss. Can you send me inbox, please, miss?
Okay, I'm gonna do it. Don't worry.
Thank you.
Diana, did you download the file? Did you fill the pool? Diana? Hello? I'm gonna close this. Okay, Elena, Jimena, and Diana, I'm gonna close the session, okay?
Okay, bye, teacher.
I'm gonna send you the file, don't worry about it, but please give me some minutes to do it, okay?
Okay, thank you. Bye, teacher.
Okay, see ya, bye-bye.
Thank you very much.
Bye-bye.